Dr. Mintah, and welcome to theWomanhood. TheWomanhood is a social media-based dialogue which seeks to focus on general issues affecting women's health. We advocate against gender-based violence and help to rediscover the Black woman's self-esteem. Today, we will be talking about our health with Dr. Nana Abban Mintah of St. John's Hospital and Fertility Center. Welcome to the program,
Thank
Doctor.
you very much.
And our topic for today is cervical cancer, and we would like you to take us through what cervical cancer is and the effect and what a woman should do. So, welcome to the program once again.
Yes, thank you very much for this wonderful opportunity. Cervical cancer is one of the topmost disease conditions, killing women. So it's very, very, very important, and it's very good for us to talk about cervical cancer. So worldwide, or I'll say globally, last year in 2018, data showed that over 570,000 people, talking about women, over 570,000 women were actually diagnosed with cervical cancer. And these are not old cases, these are actually new cases. So looking at such number, I mean, it's very, very important that we know about it and then we talk about it. I would say worldwide, looking at malignancies or cancers that can affect females, cervical cancer ranks number 4. But then you come to our environment and it's actually the leading cause of female malignancies in Ghana. So cervical cancer actually tops it here in Ghana. And we did a recent study and we realized that out of 100,000 women in Ghana, about 26 of them will have cervical cancer. So it's very, very important that we talk about cervical.
Who gets cervical cancer?
Yes, so we are actually talking about female health. So we are looking at a female. So basically a female who is sexually active is at risk of getting cervical cancer.
Do we have any ages, like from what age can a lady?
Yeah, so usually when we even tend to screen for cervical cancer, we say below 21, we usually don't tend to screen for it. But above 21, then we expect that the sexual exposure, I mean, if you've had any sexual exposure, then there's been some time. So anybody above 21 is at risk. Basically, anybody who is sexually active, any female who is sexually active is at risk. But then usually we look at 21 years. Because in terms of screening, that's what we use. So we say 21 years and above, then you're at risk of getting cervical cancer. Female above 21.
How does it or how does one get it?
Yes. So in looking at how one will get cervical cancer, we have to look at the main cause of cervical cancer. So in the olden era, we weren't all so sure, but now there's been studies and it's been proven that cervical cancer is actually caused by what we call the HPV or the human papilloma virus. So this human papilloma virus has a lot of types. Like there are over 170 types so far, and every now and then they keep picking up new types. So the types are so many, we can't go through all of them. But then we know that with cervical cancer, usually the type 16 and type 18 of HPV will tend to predispose a female to cervical cancer.
How many types do we have?
We have so many types. So many. So far, with the studies that has been done, they'll tell you over 170 types. But then there are types of this HPV which will cause genital lesions or genital warts. And then there are types of HPV which will cause warts elsewhere on the body, like warts on your hand or your feet. There are the types of HPV which are usually oncogenic. If we say oncogenic, it's able to induce cancer formation. So usually you are looking at type 16 and type 18, but there are a lot of them.
Doc, can you please tell us the risk factors of cervical cancer?
Yes. So usually looking at HPV or human papilloma virus, most of the time we tend to get it through sexual contact. That is the human papilloma virus that will give you this cervical cancer. You get it through sexual contact. Okay, so risk factors, you are looking at people who are into unhealthy sexual practices, basically. Okay, or if you have someone who has a female who has multiple sexual partners, then you're at risk of getting this cervical cancer. Okay, or you have a female who has one partner, but this female's partner has multiple sexual partners, then a female is at risk of getting cervical cancer. Also, when you take a female whose sexual age was very, very, very early, I mean the first sexual age is very important. What in medical terms we call it koitaki. Okay, so basically koitaki is koitaki is your first sex. So if the very first time you're having sex is at a very, very tender age, then you're at risk of getting cervical cancer. And to add up to it, basically once your system goes down, what we call immunosuppression, then you're at risk of getting cervical cancer. So a recent study has shown that people or women with HIV are at about a 5 times risk of getting cervical cancer. Yeah, so immunosuppression also plays a very, very important role.
Okay, thank you, Doc. We want to say a very big thank you to Fiesta Hotel at Comty 22 for giving us this nice place to have this program. So let's continue. You've given us the risk factors of cervical cancer. Now we want to know what can be done to reduce all those risks involving getting cervical cancer.
Yes. So usually we would say that the sexual lifestyle has to be healthy. Okay. The thing about this cause of cervical cancer, that is this HPV or human papilloma virus, though, is that your condom protection might even not be enough. Okay, because basically you get HPV from sustained direct contact. Okay, and looking at cervical cancer, we are talking about sustained direct sexual contact. Okay. So usually we would say that the best way is to do what we call a screening. Okay, and this is what we usually talk about, what we say pap test or a pap smear test. Okay, which is a short form for Papa Nicolau test. Okay, yes, we usually say a pap test. So it's very, very, very important for every woman who is above 21 to have a pap test done. Once you have your pap test done and it comes back negative, you wait. In 3 years' time, you have another pap smear test or a pap test done. Okay. So usually every 3 years we expect that every woman who is sexually active should have a pap test. Because once you have a pap test and we find early suspicious lesions, we are able to do something about it and it won't progress to cervical cancer.
Can you please tell us the symptoms of cervical cancer? How is a lady going to know I have to go to the hospital, I have this, I'm experiencing this? What are the signs?
Yes. So it's very, very important. So our viewers don't miss it when they start seeing it. So it's very important. So basically, if you are female and you realize any form of abnormal vaginal bleed, you should seek medical attention. So let's say you're expecting your menses to come at a particular point, but then you are seeing the blood flow at another time, or let's say even in a month you are seeing your bleeding twice or your menses twice, you have to seek medical attention, because it could be a sign, because once you have any form of abnormal vaginal bleed, any bleed you don't think is normal, then you'd have to come in for you to have a checkup done. So basically they will have abnormal form of vaginal bleed, and some of our ladies too usually bleed during sexual intercourse. Usually once you have a cancer or a tumor on your cervix, it bleeds easily. So during sexual contact, it tends to bleed. So if you have any form of bleeding, what we call postcoital bleeding or after sex bleeding, then it means you have to come in to have a checkup done. And some ladies would also have some form of vaginal discharge, which wouldn't be normal. So if you see any form of abnormal vaginal discharge, which is usually very malodorous, then it's a sign that you have to come in to have a checkup done.
Okay.
And some ladies would also have some form of itchiness, and they'll tell you, when I go and urinate, I have some form of pain.
Yeah.
I mean, these are also symptoms of other conditions, but you
Okay.
never know.
Yeah.
So once you start seeing anything like this, you have to
just
come
have to
in,
check.
yes, so that you have a checkup
Okay.
done.
Thank you so much. What should be known about the screening? How is the screening done? Like, can you please take us through?
Yes. So basically, in medicine, we say the screening is more of an invasive procedure.
Okay.
Invasive means we are going to take part of your tissues,
Okay.
like we are going to get inside you and take part of your tissues
Tissue.
and then examine it. We do
Is
what?
it you taking a discharge or a tissue?
Yes. So,
how does it-
so what happens is, because we are looking at a cervical lesion, if you go in to take a discharge, you might miss it.
Oh, okay.
Okay, so usually with a pap test, there's this kit that is already made.
Okay.
The pap smear kit.
Okay.
So we position you, the patient, and then we have our own instrument. So
Okay.
by the help of our speculum, we can actually see directly, into the vaginal canal. It goes down, and then we can see the tip
Okay.
of the cervix. Okay. So once we see this, then one of the instruments in the pap kits, we take it and then we try and take a sample.
Okay.
So we will sort of swab the area, or sort of scoop the area on a slide, and then we'll take it to the lab and do our further testing. We do histopathology on it, and then we look at the cell change. Ideally, you expect to have a normal kind of body cell at the cervical area, but then when the person has a suspicious lesion, you realize that the cells will look different under your microscope. Okay, when you do your further investigations and you stain, you realize the cells look different from the normal. Then you can say, oh, this person has a suspicious lesion.
Okay.
Then the person, that will prompt further investigation. Okay, so apart from the pap test, we do other things. There's something called a colposcopy.
Okay.
A colposcopy, basically we have this instrument which is going to magnify your vaginal area straight to your cervical area, magnify, picks up lesions, and then we can see it. Okay. And once we see any suspicious lesion, then it's our cue to do what we call biopsy taking. Okay, so in this case, we are going to take part of the suspicious lesion. We are going to just cut a little bit, and then take it to the lab and do further tests on it.
Okay. Thank you so much. Okay, Doc, let's continue. How was cervical cancer diagnosed and treated?
Yes. So in medicine, usually once we are looking at diagnosis, then we want to take the whole thing from the start. So you would want to take the history,
Okay.
Which is what we've talked about, that the female would usually come to you with some form of abnormal vaginal bleed. There's going to be some form of abnormal vaginal discharge
Okay.
as well. Okay. This patient will tell you, I sometimes have pain during sex, what we call dyspareunia.
Okay.
Okay, so the female will present with something like that. And sometimes they would have some form of pain when they urinate. So we take the history, and then after taking the history, we go on to examine the patient. Okay, so the examination is basically holistic, because we want to look at every system. Because
Okay.
what happens in cancers is that even though you might have a lesion or a cancer at one part of the body, it might end up spreading.
Okay.
And once it's spread, you're going to have it going to other parts of the body. So it's very, very important that we usually examine and we take a look at everything.
Okay.
And of course, as I said, you also want to take a look at the cervix. Okay. And once you see any form of lesion, you take a biopsy, and then you send it for what we call histopathology.
Okay.
Then you get your report. So based on that stage of history, examination, and investigations, you are able to make a proper diagnosis of cervical
Okay.
cancer.
Is cervical cancer preventable in Ghana?
Oh yes, it is. It's very, very preventable, and it's something that the general public should know,
Should know.
because people have this knowledge that, I mean, you can't do anything about
Okay.
it, all right? But then recent study has shown that once you get vaccinated against HPV, your risk of getting cervical cancer actually goes way, way, way down. Okay. I mean, of course, there are other risk factors where people have some sort of family history of cervical cancer, but even that, we know that once you get vaccinated with the HPV vaccine,
Okay.
it protects you against cervical cancer. And with the vaccines, we have about 3 main types now. Okay, we have the Cervarix, and then we have what we call the Gardasil 4, and then the Gardasil 9.
Okay.
And this basically would cover your HPV types that are notorious for cervical cancers. All these three HPV vaccines would actually cover your cervical cancer for you.
Is it expensive?
Oh, well, it's not expensive, and it's actually really available.
Okay.
So if you go to any of the big hospitals in Accra here, if you go to the teaching hospitals, the regional hospitals, and if you go to the vaccination centers,
Okay.
you should be able to get the HPV vaccine.
Vaccines.
And usually you would get about 3 doses,
Okay.
within 6 months period.
Oh, okay.
You get 3 doses within a 6 months period.
How long does the vaccine last in the body or in the system of the lady?
Okay. It's a very, very good question. And the good news is that the CDC,
Okay.
the
Which one is
Center
the
for
CD?
the Center for Disease Control.
Okay.
So they've done studies,
Okay.
and then they are telling us that the vaccine is actually lifelong.
Okay.
So once you get the vaccine, your risk of getting the infection or the cancer
Okay.
would actually go down, and it offers you some form of lifelong immunity.
Okay.
To back that, they've actually followed patients who have had the vaccine, females who have had the vaccine over 10 years,
Okay.
and they realized that the potency hasn't gone down since then.
Okay.
So there are suggestions that it's actually lifelong. Once you get the vaccines,
Okay.
3 vaccines within 6 months, then you have lifelong immunity.
Okay. Doc, can you please give us an advice? Can you advise our viewers and the public on what to do? Just give them an advice.
Yeah, so I would like to say that cervical cancer is very real.
Okay.
It's a disease that is killing our females.
Okay.
It's killing our females, so it's very, very, very important that we all know about it, and then it's very important that we know that it's actually preventable. Because once you have your regular screening done, once you have your regular pap test done, and once you are bold enough, step up and get vaccinated, then your chances of getting it goes way, way, way down. So I'd advise my viewers to go get their checkup done, go have their pap smear test done, and then go get a vaccination.
Okay. Thank you so much. My dress is by Marigold Clothing at Afariwa. You can contact her on 054-8848-414. Marigold Clothing, you can contact her on 054-8848-414. And my hair is by Gina Strength. You can also contact her on 0244-816-966. And then thank you so much to the team, Smile GH Photography. We are so grateful to Amelie, our social media, the guy who handles all our social media platforms. We say a big thank you to all the team. We say thank you, and then to Fiesta Hotel. We are so grateful for the treat you've given us. Thank you. Thank you so much for coming. We are so grateful. And he is Dr. Nana Abban Mintah of St. John's Hospital and Fertility Center. We are so grateful to you for honoring our invitation, and we look forward to see you more often. Thank you.